Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are 4 new cases of COVID-19 to report. The total number of cases is now 279. The total number of COVID-related deaths in Manitoba remains at 6. As of this morning, 5 individuals are hospitalized and there were no patients in intensive care with COVID-19. 235 individuals are listed as recovered. There are 38 active cases. Yesterday, 689 lab tests were performed, taking our total to 25,402. We've increased our testing capacity, and any symptomatic Manitoban is eligible for testing. So if you have any respiratory symptoms, fever, cough, runny nose, sore throat, call HealthLinks for advice regarding testing. We've introduced our plans to gradually restart the economy, allowing some businesses to reopen, but we continue to reiterate that this is not a return to normal. This is a gradual easing of restrictions. Our numbers have been flat as of late, thanks to Manitobans' strong efforts to flatten this curve. The efforts regarding social distancing have paid off, and we now can look to gradually and cautiously easing some of these restrictions going forward. But we need to keep our guards up. We need to continue to deal with this virus. So the basics of staying home when you're ill, even with mild symptoms, is very critical. Do not go to work, do not go shopping, do not visit anyone if you're having any symptoms of respiratory illness. Stay home, call HealthLinks for advice regarding testing. We still need to take precautions. Frequent hand washing, social distancing is important, so continue to practice that whenever going out. Remember that the reopening doesn't start until May 4th, so the previous directions are remaining in place right now, as to stay home as much as possible and to practice social distancing at all times. Staying home with your immediate family is the best way to protect yourself, the people around you, and our community. To date, we have not had significant community-based transmission or outbreaks in personal care homes. We've been able to implement a number of ways to protect those most susceptible to the severe outcomes of this virus, including those living in PCHs. Our numbers have stayed in acceptable ranges, and that's why we're now moving with this very cautious plan to start reopening the economy. Because of these plans, because of the nice weather, we've been hearing a lot of talk of garage sales, and so certainly now is not the time to be having or to be attending garage sales. Certainly we are gradually reintroducing some of these economic activities. Group sizes still remain at 10, so that's an enforceable issue under the public health orders. Avoiding large groups, avoiding touching frequently touched surfaces are all important. So right now, as we start to ease into the easing of these restrictions, we do not want everything to open at once in Manitoba. We want to take these cautiously, continue to practice social distancing, and this is especially important for those at risk of severe outcomes. So those over age 65, those with underlying medical conditions, those with immune compromise should really continue to follow the previous advice as much as possible. Stay home as much as possible, social distancing at all times. Businesses that have questions about the orders can reach out to engagemb.ca for further direction. And also directing Manitobans to visit our website for credible information, manitoba.ca/COVID-19 for up-to-date information, as well as the online screening tool. So once again, I thank Manitobans for your efforts, for your patience, and your work going forward, because we are still dealing with this virus. So thank you very much.
Good afternoon, everyone. I'm Lanette Siragusa from Shared Health, Chief Nursing Officer. Today marks, or actually tomorrow, marks a big day for us, an anniversary of sorts. It will be 3 months since we established our incident command structure. And as we look towards next week and a bit of a change in how we've been operating for the past many weeks, months, it does give us a moment to pause and reflect on where we've been and where we're going. So I just want to take the time to thank all the people who've been involved in that incident command structure. It has been an unprecedented amount of work that's happened and unparalleled progress like nothing I've ever seen in my career. It's been people working from across the province, clinical providers, support staff, administrators, vendors, unions. It's really been incredible, and I know you've all been working super hard, so I just want to extend my sincere appreciation, as well as Dr. Roussin. And also to government for giving us the space to make decisions, but also being available to support us when we come up against challenges. It really has been all of government approach, and this COVID has been bigger, obviously, than just the health system. It involves families, it involves justice, it involves the municipalities. So just want to acknowledge that. I also want to thank I call them like the unsung heroes of this COVID response, and that are the communication teams that we work with. They're behind the scenes, but we wouldn't be here without them, including room 68 at the Ledge, all the people. They're practically like family. We see them every day, and we appreciate all their efforts, so thanks to them, as well as the members of the media. Response like this would not be possible without having that conduit between the health system and the public, and it's been a really great way to get the message out, as well as to challenge us, and so it's been really good, and we thank you for that. And of course, the members of the public. Manitobans have contributed in so many different ways, big and small, but it all matters and it all contributes to where we are today. So when I look back at February and March, when we didn't know what was coming to us, and we look at now with 38 active cases, we couldn't have done it without everyone from Manitoba contributing. And as we look towards next week, we know that the work is not done and the threat is not gone. And so while the incident command is going to continue to plan and continue to progress the agenda, we need to learn to live with this virus. We need to stay cautious. We need to follow those public health orders, and we need to continue to work together in this effort. On some different matters, the public health officials, as you know, immediately will contact Manitobans who test positive for COVID-19 and begin the special work of doing the contact tracing and the daily surveillance follow-up. And the contact tracing is a significant tool in our fight against COVID-19 as we track and trace potential exposures and ensure that Manitobans who test positive have the support they need to isolate and recover. Beginning today, the healthcare providers who conduct these case investigations will start asking these COVID positive patients several questions related to their race, ethnicity, and or Indigenous identity. These questions are important to our understanding of the impact of this virus on Manitobans from various backgrounds and will help us identify any disproportionate impact on specific populations or issues with access to services which may exist. So the information will also improve our ability to support community organizations that play an important role in the local response. So Manitobans are reminded that your response to these questions is totally voluntary, but we do encourage you to share this information as it's important for us as we monitor this virus. So the information will be collected and stored securely and treated in the same confidential manner as all other healthcare information. Another highlight to identify, starting next week, Manitobans will be able to access their own negative test results. A secure online portal has been established, which will allow people to check their own results. Those who are tested negative will receive an information sheet about how to register and access these results. The information is also available on the Shared Health website. Users will need a Manitoba Health registration card in order to access their results online. And for those that don't have a Manitoba Health card or those who don't have access to the internet, a toll-free number will also be available beginning next week. The phone line is going to be operated by our COVID-19 contact center, and they will ask some questions to ensure your identity before providing any test results. So next week we will give you that 1-800 phone number once it's up and running. The online access to test results is something that is in place across many other jurisdictions in Canada, and it was a commitment that was made as part of Manitoba's clinical and preventive service plan. So I'd like to congratulate digital health staff who have worked tirelessly to get this set up, and with the help of Canada Health Infoway. And then also, Dynacare has been an important partner for us over the past month as we are waiting to get this online portal set up. So we just want to thank them as well for their great partnership and service to tie us over until this point. As mentioned yesterday, there is a new community testing site that is open today in Swan River. It's located at the Manitoba Public Insurance Facility on 4th Avenue North. The hours of operation are from 10:30 a.m. to 3 p.m., 7 days a week. And I would also like to provide you with an update of efforts underway to support access to testing for our homeless and shelter population. This work has involved a number of community partners and will involve a new testing site that is established at the Thunderbird House, as well as a mobile service to go out to certain patients who aren't able to travel. So we'll see more progress on that in the next 2 weeks, but it has been formally approved and it's underway to mobilize. And as a reminder, our testing criteria has been expanded to include anyone experiencing flu or cold-like symptoms, such as a fever, a cough, a runny nose, or a sore throat. And one last thing is that we have worked hard to ensure that Manitobans can access up-to-date information about the services through the healthcare system, and that work continues. As of today, we have located resources for and from Indigenous communities in one easy-to-find spot online. So the site will include mental health and cultural healing resources, information for patients and providers, as well as prevention information, such as guidelines about social distancing and hand hygiene, and also links to a number of First Nations and Indigenous organizations, as well as government departments. So anyone who wants to look at that web page, get access to the information, can go to sharedhealthmb.ca/COVID-19. And with that, we'll open it up to questions.
Thank you. A reminder to our reporters online, you will have one primary question and one follow-up question. Up first, from Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Dr. Roussin, as we know, businesses that are reopening have a large set of rules around social distancing and cleaning that they have to comply with. We know here we're going to be doing random inspections, and in Ontario they've hired additional health inspectors to help with enforcement. Is that something we're going to be doing here? And given that we will have a lot of different businesses opening on Monday, are we resourced to stay on top of inspections and enforcement?
That's right. So we've been planning on how we're going to enforce this, and again, most of it is going to revolve around education and assistance. But the ability to enforce is there. We have a number of public health inspectors already on board. And so certainly nothing's off the table as far as expanding things, but right now we feel we're in a good place to be able to enforce things.
And as a follow-up, we know that conservation officers, when it comes to campsites, will be helping with enforcement on campgrounds. Will we see additional conservation officers be hired or additional resources for them to help with that?
Well, I think the same thing. I think right now the planned enforcement, we're in a good spot right now, but nothing's off the table. If we need to expand things, then that could occur.
From the Brandon Sun, Bud.
Yes, that's Bud Roberts from the Brandon Sun. Dr. Roussin, could you expand on how gathering this information on race, ethnicity, Indigenous will help in the battle against COVID? I understand that the jurisdictions do this now and have been doing this.
That's right. Yeah. So it's not certainly unique to COVID. It's just something that we were implementing now. We know that there's a number of conditions that can disproportionately affect people based on different things such as income or ethnicity. And so we want to ensure we're collecting this data to be able to understand whether there's a disproportionate effect based on ethnicity with COVID. So this is so it all begins with accurate data collection, and so certainly it's a self-declaration. It's voluntary, but we think it's a real good step to be able to start collecting information to be able to show if there are any disproportionate effects.
Okay, thank you. And this is for Lanette. There was a news release from the Manitoba Nurses Union regarding the emergency order for limiting staff at long-term care facilities. They say it allows employers to suspend employment standards and collective agreement provisions to protect nurses and workers. Just wanted to get your response to that, please.
I haven't seen that document, Bud. But I would say there have been, because of the changing in schedules, there have had to be some, the emergency orders do look at the collective agreement. But of course, we would do everything we can to make sure it's as least disruptive to the staff and follow as much of the parameters of the collective agreement as we possibly could, but appreciating that schedules will change, and we have to be adaptive to that in order to meet the public health orders and keep our seniors safe.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Dr. Roussin, what can you tell us about the 4 new cases? Are these health workers, family members who had it, or are these people who maybe can get tested under the new expanded criteria who wouldn't have been previously able to go get tested? I think Manitobans who are being quite cautious still want to know about the trends that we're seeing with these cases popping up.
Right, so these cases just get reported this morning, so I don't have a lot of information about the backgrounds, about where they were tested or why they were tested. So that information is still pending. We just have the case counts that were reported as of this morning. So we're going to continue to follow that. We have a number of metrics that we're following for our reopen strategy that will certainly relate to community-acquired cases. And so we'll be updating things as we get more information.
Okay, and then just as a follow-up question for Lanette, since your last update, have any more healthcare workers tested positive for COVID-19?
Yeah, that's a good question. So we actually transitioned our reporting structure. It was with staff health, and now it is with our COVID center. So I can provide. In total, there are 25 cases that are healthcare related, that are not travel related. If you include the travel, there are 33 cases. 19 of those cases have recovered, and there's been a total of 601 healthcare professionals tested that we have on record. There are 22 positive cases from Winnipeg, 2 in Interlake Eastern, and 1 in Prairie Mountain Health. And the breakdown is 10 nurses, 4 medical staff, and 11 workers who are either allied health or support staff. And as well, we've had 11 recoveries to date.
Thank you.
From the Winnipeg Sun, Scott.
Hi, Scott Bilk here, Winnipeg Sun. Question kind of going back to, I think it was Dan's question. Well, obviously, maybe the 4 cases today and maybe the ones yesterday or the day before aren't known, but I mean, there's still cases trickling in. Do you know at this point where they're coming from, given the travel restrictions and all the social distance orders and all that stuff? Are the majority of them coming from healthcare? Can you say at this point, at least with some of the more recent numbers?
Right, so I can tell you that, so one of the metrics that we're going to follow is the 7-day running average of cases that we can't link to either a known case or travel, and so there's been 9 of those, and so that's part of our metric. So we do still see some cases that are popping up that we can't link to known cases or to travel.
Okay, and second question. In terms of retesting those who have already tested positive, is there plans for that? Given some of the news is this virus can stay in the body for weeks or days at least, and so is there plans to retest? And is there a concern that when after people have stayed 14 days at home and no symptoms and all that kind of stuff, are they still, if the virus is in the body, are they still, I suppose, contagious?
Yeah, so if somebody is 14 days past the onset of symptoms and have no more symptoms, they're considered recovered. There's no need to do a further test on them. The nature of this test, this molecular test, only tests for genetic material of the virus, not for active virus. And so we could have people who are positive, totally recovered. We can still detect that genetic material from that virus for sometimes weeks afterwards, but those people are not infectious. So there's no reason to retest those individuals. We'll do 14 days post-symptom onset, asymptomatic, you're recovered. We're not concerned about that person transmitting the virus.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin. It's Mohammed from CBC Radio Canada. I have a question about serological tests here in Manitoba. You stated 2 weeks ago that you were in validation process on that. What could you tell us about this today?
Yeah, it's still very early. There's no routine serologic testing being done in Canada right now. There's certainly a national group working on it. We have doing some early stages of these type validation things, trying to find a valid way of testing these things. So it's still early on, it's very likely we'll be getting to that. Hopefully in the near future, where we can do these seroprevalence studies to give us an idea of the true infection rate in a population. But it's still early. We don't know whether these antibodies are neutralizing, whether they provide protection. We don't know how long that protection is, if it does provide protection. So we're really early on this, and so there's still a lot yet to come.
Thank you. And as a follow-up just on this topic too, could the results of this test change the reopening strategy of the province?
Well, not certainly not phase 1, because we're doing this without serologic type testing. So going forward, in most epidemics, serologic testing can play a big role, especially once we determine whether immunity is granted by those antibodies. So it sure could play a big role, but it's still yet to be decided whether immunity is conferred or what type of immunity and that duration. So still a tough question to give a definitive answer to at this point.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. Bartley Kiva here at CBC. Apparently I don't know my name. There are other COVID-19 symptoms that have been identified as indicators, including, swelling on the feet, among others. Why hasn't Manitoba added more COVID-19 symptoms to the list that would allow people to be tested, in addition to the sore throat, cough, runny nose, fever?
Yeah, so we continue to look at that at our symptom list. What we have added, and for quite some time, is that any clinician who suspects a case of COVID-19 can certainly submit a test or submit a client for testing. So those type of less common symptoms, certainly if a clinician feels that the individual in front of them needs to be tested for COVID-19, that can absolutely be done. So we do take account for some of those things, loss of smell, some of the dermatologic findings that have been reported anyways. And so certainly a clinician feeling that someone should be tested can absolutely do that.
Okay, thank you very much for that. Completely different question. What plans are in the works might be more for Siragusa, I'm not sure. What plans are in the works to restore day programming and other services for people with intellectual and physical disabilities?
Yeah, so I think in the in the phase one, I don't think there's going to be a major change in that approach. A lot of that was limited to essential type services with a lot of restrictions, a lot of cautions. And so again, when we're looking at people who are really susceptible to the infection, we're going to go very slowly. So I think in this early phase, anyways, there's not going to be a lot of changes to that.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, campgrounds open a week from now, and I'm just wondering, are you comfortable with the campgrounds opening at what I believe is normal capacity, with some of the tent sites fairly close together? Are you confident with that this won't increase the numbers?
Well, I mean, with the reopening strategy, we've put in a number of restrictions to limit the chances of that. Certainly we're going to follow the numbers closely, because we know as we lift the very stringent restrictions we had, there is that, the potential of increased transmission. And so we know we can't keep the restrictions in forever, and so we have to do it gradually. In campgrounds, when you're looking at outdoor spaces, there's such a reduced risk of transmission of this virus in outdoor places. So right there, that helps with that situation. All of the other cautions are still in place, right? Shouldn't be traveling with members of outside of your family. Shouldn't be gathering in large groups. If you do gather with people outside your family, socially distance, washing hands frequently. No one who's ill should be going out. So there's still a lot of cautions in place. So I think that what we have there still represents a safe way forward.
And another outdoor area is restaurant patios. And what I'm hearing from some people in the public is that they see it maybe as something of an inconsistency in the messaging that you shouldn't be gathering closely with people outside your own household, but you can go to a patio and sit around a table of up to 10 people. So what are the rules for patios, and are you concerned that even with reduced capacity, people sitting around the table at a patio with people outside their own household could lead to an increased risk?
Yeah, so so we have a couple factors that are on the patios. One is the reduced capacity. The other one is we're outdoors. So those are two things that are going to limit the chances of spreading this infection. And then, so again, when you're making these rules, you have a really high level guidance for it. So certainly reduced seating at the patio, social distancing whenever possible, frequent hand washing. No one who's ill should be going there. And really, that's not my advice, is to go sit at a table of 10 people from different households. That's not public health advice to do that. Certainly, it's tough to write that in an order and to have that enforced. But we're gradually opening things up. And I think Manitobans get this. Manitobans understand how important this is, how important it is for this to work, that not everyone's going to just start rushing out thinking that this is a return to normal, because it certainly isn't. We can't keep those restrictions at the level we had for much longer. We need to start gradually reopening the economy, but we need to still deal with this virus. So certainly being outside in a patio situation with reduced seating, we're doing a lot to limit the transmission of this virus. And so, and it's the same thing with visiting friends and family. There was nothing in the order that would have prevented that at any time. But our speaking is the more close contact you have with more people, that does increase the risk. So with people who are certainly susceptible to severe outcomes, you have to be extra cautious. If we're visiting friends and family, if you can do it outside, that's even better. If you can maintain physical distancing when you're doing it, even better. And so we need to still be cautious about this virus. But at the same time, we realize we have to start reopening things. This virus isn't the only thing that affects people's health.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwing from CTV Winnipeg. So we did 689 tests yesterday. Is that kind of within the range that we wanted to see when we opened up the testing criteria, and maybe do we need more every day?
Yeah, so it's, with the testing numbers, the actual test numbers aren't as important to me as the test positivity rate. And so our test positivity rate's been quite low for the last number of weeks. And so when we think about, the numbers of tests we want to do, it doesn't make sense to do thousands upon thousands of tests when you're getting, 0.5% of those tests coming back positive. So it's really that positive test rate that's important. And so certainly if we're getting these type of numbers with that rate, I'm happy with those. What's more important is that we've opened up the testing criteria, that now any symptomatic Manitoban can present for testing. And so I think to have the capacity is important. To have the wide eligibility criteria is important, and then the numbers themselves, as we're looking right now, is not that important of a number to me.
Thanks. And this one's for Lanette. With the single site rule taking effect today, how is that affecting the hours per resident? Is there going to be enough staffing? We're hearing about concerns about short staffing.
Yeah, so the hours per resident day is our standard and still applies. So there's different hours per resident day depending on the needs of the population. But when we were doing the modeling and looking at the staffing needs, we absolutely kept that in place. So it should be standardized across the province.
From the Winnipeg Free Press, Carol.
Good afternoon, it's Carol Sanders at the Free Press. I have a question for Dr. Roussin. For weeks you've had very cautious, consistent, simple, straightforward messaging, and now it seems kind of fuzzy and more complicated with contradictions with the new measures that are able to take place on Monday. You're encouraging people not to go to the cabins at Grand Beach, but they can camp at Grand Beach. People are encouraged, not to visit elderly grandparents, but they can go golfing with them. Encouraging people to keep their social distance, but they can go to a patio and be served by a stranger. I know it's hard to write in every detail of an order, but can you talk about what seems like contradictions in some of the measures that are being lifted?
Yeah, and so I wouldn't consider a contradiction, right? Because these are just easing of restrictions. So it's not directing anyone to do anything. And so, so it's not a contradiction. You are right, though, it does get complicated at this point. Because what we have is we're still in a pandemic. We're still early in this pandemic. And so we still need to deal with this virus. But what we do know is that these restrictions, the heavy restrictions, also have huge impacts on health. And so we need to find a way to balance the need to protect those most susceptible, to ensure that we don't overwhelm our healthcare system, but with also the other type of health factors that these restrictions have been, affecting as well. So it does get complicated to message because it's we are gradually reopening things, but we want Manitobans to stay cautious, and that's the thing. So when we're talking about golfing and outdoor events, we know transmission of this virus is much limited in outdoor places, but we want to reduce those crowd sizes. Visiting friends and families, well, if you can do it outside, if you can physically distance, then that's really reducing the risk. If you don't do that, then there is some risk involved, and if those people are susceptible to severe outcomes, then there's some more risk involved. And so what we really want to do is to have Manitobans make an informed choice, and I think that's okay because I think Manitobans have made some great choices. Our numbers are showing that Manitobans are listening, Manitobans know how important this is, and Manitobans have made some great choices. And so now going forward, we're going to just try to gradually ease things up so the messaging does become complicated because we don't want everyone to rush out and return to normal on Monday. We have to be very cautious still. So with everything we do, we still have to think about this virus and know that we're going to be dealing with this virus for quite some time. But we've put ourselves in a position to start gradually reopening some of these things. So, and then we're going to follow it very closely.
My follow-up, I think, might be for Lanette Siragusa. I'm wondering about asking the COVID positive people questions about race, ethnicity, and or Indigenous identity. What kind of discussions and planning went into deciding to do this, and why wait? Why wait until now to start asking these questions? What was the planning around this, and why did it not happen until today?
Yeah, so it has been work ongoing. There is research out there. Our own Dr. Marcia Anderson actually is leading this with a team, and a very respected healthcare leader, physician, and passionate on this topic. So we have been working with the First Nations community, with FNISM, to make the agreement that we can collect that information for those purposes, and then also even expand it a bit further for different ethnicities. So it has been a work in progress. It's just being announced today.
Thank you. We have a few moments left, so if any of the reporters have further questions, please feel free to ask them now.
Keep us here at CBC. Can you please clarify your answer to Scott Billick's first question? You talked about a 7-day rolling average, 9 cases. Can you please, does that mean in the next coming weeks that you're going to be ratcheting back on restrictions if there's 9 community transmission cases in a 7-day rolling average? Can you explain that?
Oh, right. So that's just one of the many indicators that we're following. So we're not going to rely on any one given indicator. But the number 9 is the actual 7-day rolling average that we have right now. And that's what I was referring to. Sorry? The 9 is still...
9 is... 9, that's your current...
That's right.
Average.
That's right.
Oh, okay. All right.
Marnie Blunt from Global News. This question's for Lanette. Some businesses are choosing to use protective gear when they reopen Monday, even if it's not mandated. Can you talk a bit about how that can be done safely? Like, for example, are servers supposed to be changing gloves every time they serve a different table on the patio or that kind of thing? Can you just talk a little bit about how using different protective gear can be done in a safe manner?
Yeah, I think for the most part, medical PPE needs to be kept for the clinical providers who are working in those environments. But for other environments, there may be opportunities to use cloth masks and cloth gloves, even for that matter. So we are looking at that. There is emerging evidence as to when it would be appropriate, and how Dr. Roussin's talked several times about it doesn't necessarily protect you, but it protects others. So we have no opposition to it. It's a choice, but it is another layer of protection that people may want to consider as as the restrictions are being lifted and we're still in a state of caution.
Diane from 680 CJOB here. Do you have any idea when people will be able to visit loved ones in hospitals again? I know yesterday you said care homes certainly not allowing visits anytime soon, but any thoughts of potentially changing that for hospitals?
Yeah, it's we definitely want to be doing that sooner rather than later. I think we just need to watch and wait. We are looking at what options would be available to us, maybe even potentially outdoor visits, like on a patio or in a courtyard. So hopefully our goal would be as soon as possible. We totally understand that the human element of this virus still has an important role in the healing of individuals. And so I can't give an exact date, but we absolutely are looking at it, and we would like to implement it as soon as possible without introducing risk to those populations.
Dr. Roussin, it's Brent here from the Sun again. Just a campground question. Apparently, Saskatchewan and Alberta only allow residents of their respective provinces to book campground sites. Can you tell me what the situation is here in Manitoba?
So that's something that we're going to look at. I don't know if I have I don't have a specific answer to that, but certainly we have the 14-day self-isolation period here from visitors from outside of the province, right? So, so it's something that we're going to have to address because that's in force, and that's an enforceable public health order. If you're coming from outside of the province, other than routine travel and bordering communities, you're required to self-isolate for 14 days.
Great, thank you.
Hi, Dr. Roussin.
Dr. Roussin, I know you've asked, and you've been patiently responded to questions about schools several times this week. Just one more time, though. If Quebec has so many more cases of COVID-19 and they're looking at reopening schools, why is Manitoba reluctant to do so?
Yeah, I think it's, I mean, all of these plans are province-specific, and so we certainly look to other jurisdictions on things they're doing, but we're going to do a Made in Manitoba plan. And so we know that kids, we learned, a lot as this pandemic went on, that kids probably don't transmit this virus. They're not huge transmitters of the virus, so they certainly transmit it, but they're not the huge driving force behind the pandemic. Unlike things like influenza, where kids are often a driving force in the transmission of this. So I think it's something that's been considered, but it's certainly not going to be part of our phase one. And then when we look at the timing, now we're into June, and we're and we have such short time frames. So it just didn't seem to be a work well for the Manitoba's plan. But we always continue to look at options.
Thank you.
Another thought. Are you aware of a positive case of COVID-19 in a care home in Russell? And if so, what precautions are being taken there?
I have not been notified of that.
Okay. Dr. Roussin, Carol at the Free Press. I just wanted to ask about playgrounds. Is that the same reasoning for playgrounds? Kids aren't thought to be big spreaders, so that's why it might be safe. I'm just wondering because, yes, the virus can last for up to 72 hours on hard surfaces, and kids climb all over the place and are hard to keep away from each other, and it's hard to keep their hands away from their faces when they're out in the playground. Is that the reason why playgrounds are allowed to open on Monday?
Yeah, there's a couple of things. One is it's outdoor. It's outdoor. We're still going to have restrictions on, the group sizes can still apply. The physical distancing advice is still there, and then the frequent hand washing is there. And so we know that we're going to be dealing with this virus for some time, but we have to find ways of still moving on with things, and we think that playgrounds is something that's going to provide a very low risk of transmitting this virus.
Even if there's no hand washing available there?
Yeah, well, this is people should be thinking about having hand sanitizer when they're out and about and being in high touch areas, and so this is all all important things. But we think it's a low risk situation.
My last question for Lanette, sorry. Lanette, can you give me any more information on the healthcare worker in Prairie Mountain Health, the type of worker, if they've now recovered, that kind of thing?
I do not have that, Bud, but I can certainly look into it. That is a new development in the past week since I last reported. Let me get more information for you.
Thank you very much.